Perform hand hygiene before coming into contact with the patient. When entering patient room, always maintain patient's privacy. Although patient is unconscious, introduce yourself and let them know why you are there. Always check to see if you have the correct patient. Lower the bedside rail and inspect the patient's oral cavity and test for gag reflex. Place a towel and waterproof padding to protect the patient and environment from any spill or splatter of fluids. Position the patient on their side, facing you near the side of the bed. Turn the patient's head toward the mattress. Then place an emesis basin under their chin. When the patient is relaxed and the mouth is open, insert a padded tongue depressor between the back molars and gently separate the upper and lower teeth. Do not use force. Use toothpaste to brush the patient's teeth. Using a gentle up and down motion, clean the chewing and inner tooth surfaces, the outer tooth surfaces, brush the roof of the mouth, gums, inside cheeks, and gently brush the tongue but avoiding stimulating the gag reflex, if present. Moisten the brush with water or essential oil mouth rinse and use this to rinse the oral cavity thoroughly. Repeat the rinse several times. Suction the secretions as they build up. Clean any excess fluid that may be around the patient's mouth. As part of follow-up care, reassess the patient's oral cavity to evaluate the effectiveness of the procedure and the progress of any inflammation, lesions, or any other disorders. Apply a thin layer of petroleum jelly or water-soluble lubricant to the patient's lips. Remove and dispose of supplies used. Position the patient back comfortably. Higher the bed rail for patient safety, and position the bed back in the lowest position. When entering the patient's room, always maintain privacy. Be sure to introduce yourself and let them know what you are there for. Confirm that you have the correct patient. Ask the patient to remove the dentures. For a patient who cannot remove his dentures, grasp the front of his upper plate with your thumb and index finger wrapped in a gauze pad. Pull down the denture. To remove the lower denture, gently lift it from the jaw. Turn one side down and take it out of the patient's mouth. Once removed, place patient's dentures in a cup labeled with their name, date of birth, and patient number. While working at a sink, line the bottom of it with a washcloth to protect the dentures in case they are dropped. Apply toothpaste or denture cleanser to the toothbrush and hold the dentures over the prepared sink or emesis basin. Clean the biting surfaces using a back and forth motion. Brush from the top of the denture to the biting surfaces using short vertical strokes. Clean the inner tooth surfaces using short vertical strokes. Clean the undersurface of the denture using a back and forth motions. Examine the denture while cleaning it, noting any cracks, rough ridges, or loose teeth. Rinse the denture thoroughly in tepid water. If desired, rinse dentures with mouthwash. Thoroughly dry the dentures and place into a cup labeled with the patient's name, patient ID, and date of birth. When re-entering the room, confirm the identity of the patient. If the patient uses an adhesive to seal the dentures in place, apply a thin layer to the undersurface before insertion. For one who does not use adhesive, simply moisten the dentures. When assisting with the insertion of dentures, press firmly to seal it into place. Perform hand hygiene when coming into contact with the patient. Before bathing your patient, although unconscious, introduce yourself, confirm the identity of the patient, and let them know what you're going to do. Fill your basin or bucket with warm water, gather all your supplies, and place them on the overbed table. When entering a room, always maintain patient privacy. Check the temperature of the room and make sure it's not too cold for the patient. Raise the bed to a good working height for you. Lower the side rail on the side that you are working. Place a bath blanket over the patient. Remove the patient's gown without exposing the patient. Place the gown into the soiled linens. If the patient is conscious, offer the patient the washcloth to wash his own face if possible. If not, make a mitten by folding the washcloth around your hand. Wash the resident's eyelids from the inner side of the eye to the outer side of the eye using plain water without soap. Wash the eye on the opposite side first, then the eye closest to you. Since the eyes have mucous membranes, you should wear gloves for this part of the procedure. Rinse the washcloth and dry the washed area. Place a towel under the hand farthest from you. Repeat for the other hand. Wash, rinse, and dry the chest, the arms, hands, and the armpits. Apply deodorant for the patient to the armpits. Ask the patient to turn his back towards you. If unable, assist the patient. wash, rinse, and dry the patient's back. Apply lotion to the patient's back, massaging the entire back lightly. This helps with circulation. Remove gloves, wash your hands, and help the patient into a clean gown or other clothing of choice. Remove bath blanket and patient blanket and place into the soil lens. Apply clean linens to the patient's bed. Comb the resident's hair, help with other grooming requests. Raise the side rail and lower the height of the bed. Make sure to leave the patient comfortable and place the call light within reach of the patient. Perform hand hygiene when coming in contact with the patient. When entering the room, provide patient privacy. Introduce yourself and confirm your patient. Apply your gloves and let the patient know what you are there for. Lower the side rail and place a waterproof pad under the patient's buttocks. Have your patient lie with their knees bent. Prepare your washcloth into a mitten and apply the perineal spray. Expose the patient's perineum. Using a wet washcloth, wash the patient's upper thighs. Rinse and dry this area. Wash the labia majora. Using your non-dominant hand, gently retract the labia minora from one thigh. Using your dominant hand, carefully wash in the skin folds from the perineum to the rectum. Wash the urethromeatus and vaginal orifice. With your dominant hand, wash down from the pubic area toward the rectum in one stroke. Use a separate section of the cloth for each stroke and clean thoroughly around the labia minora, clitoris, and vaginal orifice. While washing, check for pain, redness, swelling, discharge, irritation, or skin breakdown. Dry the washed area thoroughly. Lower patient's legs and remove and dispose of the waterproof pad. Assist the patient into a comfortable position. As part of follow-up care, assess the patient's comfort level and degree of fatigue. Lower the side rail and expose the perineal area of the patient. Place a bath blanket on the upper body to expose the upper thighs of the patient. Using a wet washcloth with soap applied, wash, rinse, and dry the patient's upper thighs. Cover the patient's thighs with a bath towel and raise the bath blanket to expose the genitalia. Lift the penis and place a bath towel underneath it. Gently grasp the shaft. If the patient is uncircumcised, retract the foreskin. Starting at the urethral meatus, wash the tip of the penis with a circular motion from the meatus outward. Repeat this action with a fresh area of the washcloth until the penis is clean. Rinse and dry the tip of the penis gently, and if the patient is uncircumcised, return the foreskin to its natural position. Dry this area thoroughly. Check for redness, swelling, discharge, irritation, and skin breakdown. Remove soiled linens and place in dirty linen bag. Assist the patient into a comfortable position and raise the bed rail. And lower the bed back into its lowest position for patient safety.